Okay, we're going to try. Okay, yeah, it's open for me now. So maybe it'll just take a while. Apologies, it hasn't opened for you. Maybe just leave it while I go through it and then it will come up for you in a bit. So let's go through this one. So this is a CT head that comes in and they look like could be a younger patient. And you can tell because there's not much in the way of these, the gyral fold. As people get older, they start to kind of, I guess the head just dries up a bit, right? And actually their brain looks kind of quite full. It looks actually pretty good. Scrolling through. If anyone sees any abnormalities, give us a shout. If not, no worries. Let's have a look. Again, let's go from the very, very top. So what I always do, I always go from the very, very top and also have a look at these sort of the sulci here and just make sure they look very symmetrical. And actually they look pretty symmetrical coming down this way. Everything looks okay so far. Coming further down, coming further down. I haven't seen anything, any big bleeds or anything like that. The lateral ventricles look okay. They look very kind of slit-like, but it's probably because they're quite small, they're quite young, so I'm not particularly worried. And yeah, and then you come down to the kind of foramen magnum, make sure there's no crowding, no posterior fossa mass either. So this person was a trauma. And so when you have trauma, what happens is like these acceleration deceleration injuries, right? So you're going to go forwards and they're going to hit the front of the head. And then that acceleration deceleration injury will normally end up having injuries in the frontal lobes and in the temporal lobes. So let's have a look at that frontal lobe. And now, exactly there. Can you see that there? Let's zoom in a bit for anyone that can't see. Just there, coming there, you can see slight hyperdensity around there and a hyperdensity within the center. So that would be in keeping with multiple contusions. So these are contusion bleeds. They don't look like subdural hematomas and they don't look like subarachnoid bleeds either, because subarachnoid bleeds would be very, very linear. So therefore, we've got some small contusions in the frontal lobes. It looks like they're mostly on the right frontal lobe from what I can see. The next place you want to look is going to be the temporal lobe, because that's another area where you can get significant impaction. But I don't think we see any sort of contusions, do we? Actually, look there. There's a bit of hyperdensity located there. Coming further up, you might have to be a bit worried. There could be a bit of a small bleed there. But everything else looks okay. So we could say that, okay, well, nothing else is going on. But now what we need to do is try and see if we can window it a bit. So now when I windowed it to about this much, can everyone see that there's actually more to this? Can you see that there? Coming down that way. Yeah, so there's really, really small subdural hematoma just there. Very, very thin. Can you see that? Very, very like you could potentially miss it because if we go back to reset and reset all, because the bone is so bright, you could just think, oh, it's just the bone. But actually, when you come to here, you can see there's a separation between the bone. And this is where I think is quite useful to look at the CSS bases, right? You remember how I was saying try and look for where there's symmetrical. So it's symmetrical up here, but when you come up to around this area here, so let's come down to this region, you can see that it doesn't look quite symmetrical. There's that hyperdensity that's located there. So that's therefore you got the contusions located within the frontal lobe, and you've got a small subdural hematoma located within the right parietal region as well. And we're not completed with our examination. We've also got to make sure there's no fractures anywhere. So go to bone window. Actually, I'm going to show you guys a little trick. Hopefully, it'll work with this platform. But a way to look for fractures and I don't know why people don't do this, but I've genuinely found loads and loads of fractures doing this particular thing. So I don't know if anyone's seen it, but what we'll do, if you go to NPR, go missed oblique, do that. And then if we go to here, it says MIP, and then what you do, you increase the MIP to, let's say, 50, and then you window, just so you kind of, it looks like more of a skull. Let's try and window a bit more. And then you kind of look at it again. And this is what I genuinely do in my practice. I would literally look at this in this kind of view just to make sure there's nothing else going on, scrolling through, scrolling through, scrolling through. And can you see that? That doesn't look quite right. So then you got to kind of manipulate it a bit. So I will show you. So this is suture. I'm going to zoom in a bit. So this is suture, this line here. Nice wavy line because you've grown up with that, right? You've grown up with that. So there's been part of you forever. This is not a suture. It's not wavy. It's very, very linear. It goes all the way down like so. Therefore, this is a fracture. And I think doing this method, I picked up loads of like subtle. I don't think this is that subtle, but doing this method, I have picked up loads of subtle fractures. And now when we go to bone windows, let's go back and see. Look, you can see just there. There's a fracture there. It's going all the way along, all the way along, all the way along. So at first glance, you may think that, oh, it's not a fracture, it's just a suture. But actually, what's happened is that we thought the impaction was probably somewhere around the frontal lobe because, acceleration, deceleration. But if you've got a fracture in the occipital, you probably what's happened is that you've got a injury in the posterior aspect, and then you've got a contra injury. So contra injury is when you've got an injury on the opposite side. Now, the only thing I'd say is that when you're looking for contra injuries, don't just be like, okay, they've got hit on the back of the head, so therefore it must be the front of the head. You've got to remember that these are 2D images of 3D structures. So it could be diagonally across, diagonally that way, diagonally that way. So you just got to make sure you've had a good look around the opposite area, generally speaking, to look for whether there's any other fractures anywhere else. But so in this one, I think on initial inspection, you may be forgiven to think, oh, you know what, it's pretty normal. I'm just going to scroll through. There's nothing wrong. But once you realize the trauma, go for the frontal lobes, the temporal lobes, do window, look for any potential small subdural hematomas. Try that MIP thing. I genuinely think that's a bit of a game changer, and I've spotted lots of small fractures doing that. I'd highly recommend it. Facial bones, all that kind of stuff from doing that. So try that. And you know what? Tweet me, let me know what you think.